Hi, this is Kimmerman and I will teach you how to do IV cannulation. So what is the purpose of applying cannula to our patients? So this is intended for fluid replacement, total parenteral nutrition, and blood transfusion. So what are the cannula types or gauges we are using here? Of course, we have here the orange type, orange one, the gray one, the green, the pink, the blue, yellow, and we have here the purple, which is the gauge 26, pero we don't have the supply here yet. So this is gauge 14, the orange, gauge 16, the gray, gauge 18, the green, gauge 20, gauge 22, and gauge 24. In trauma cases or emergency cases, we use the gauge 14. This is a large bore cannula. Also, the gauge 16 and gauge 18. But commonly, we use this big bore or the large bore, the orange one. So the minimum gauge for adult is the gauge 18, which is the green one. And for the pediatrics or the children, it's gauge 20. Gauges increase as the number or the number of the cannula decrease. Yes, the lower number means the larger the bore of the needle. So now we will show you how to insert the cannula to our patient. So what are the materials we need for inserting the IV cannula sa ating mga pasyente? So what we need is tourniquet, plaster, gauze, alcohol swab for disinfectant, and of course cannula. In this video, I will show you, or I will use this blue cannula, which is the gauge 22, because this is the supply na sobra sa akin. I have many supply of this other than this cannulas. So check it out. We will now insert it to our patient. So now we will approach the patient. Of course, first ask his name, check for his medical record and his armband. And now we are ready to insert the IV cannula to our patient. First things first, of course, wear the proper PPEs like this, gloves. I'll wear my gloves. Wearing your gloves for to avoid cross-contamination of infection. Then select for the appropriate vein. Check for the patient's vein. Use the tourniquet. Apply it. Apply the tourniquet and locate the vein which is suitable for you to insert the cannula. Swab it with alcohol from inner to outer by circular motion. Then let it dry. Release the tourniquet and prepare for your equipment, for your cannula. Use the cannula. I will use a gauge 22 cannula. Check for the quality of your cannula. Pull a little if the needle is functioning. So it's okay, it's good. So now, after drying it for 2 minutes, reapply the tourniquet. Then we are ready to insert the IV cannula. Maintain a 15 to 30 degrees angle. Look for the backflow. There's the backflow. Retract the needle a little bit and push the whole cannula inside. That's it. Release the tourniquet. Secure the cannula. And retract the needle. Secure it with the plaster again. And after securing, now you have your cannula placed. After doing so, write the name, write your initial, the time, and the date from when did you apply the cannula. Document it properly on your chart, and that's it. It can stay for 7 to 2 hours for the patient, and you can release it after 3 days. So this is Kimmerman from Kimmerman Studio, and this is our IV Cannula 101.